There was no excuse in this time and in this country for the spread of a deadly new epidemic. For this was a time in which the United States boasted the world's most sophisticated medicine and the world's most extensive public health system geared to eliminate such pestilence from our national life. When the virus appeared, the world's richest nation housed the most lavishly financed scientific research establishments, both inside the vast governmental health bureaucracy and in other institutions, to investigate new diseases and quickly bring them under control, and making sure the government researchers and public health agencies did their jobs were the world's most unfettered and aggressive media, the public's watchdogs. People died while public health authorities and the political leaders who guided them refused to take the tough measures necessary to curb the epidemic spread, opting for political expediency over the public health. The preceding are not my words. They are found within the first few pages of And the Band Played On, a powerful book written in 1987 by Randy Schultz, documenting the abhorrent response by our government to the HIV/AIDS crisis. Without question, his observations could easily be applied to the SARS-CoV-2 pandemic. With HIV, those in public health were quick to assuage the public's fears concerning who would be at risk, and did so through the creation of a 4-H club to which homosexuals, Haitians, heroin users, and hemophiliacs belonged. Having not learned their lesson, they once again created a 4-H club with SARS-CoV-2. As a consequence of their failure, millions who are not hypertensive, not hyperglycemic, who do not suffer from hypoimmunity, and who do not live with a high BMI, find themselves living with a persistent virus for which there could have been a reliance upon 40 years of evidence-based medicine on September the 28th and 29th of 2020. To preserve the immune competence and cognition of the current and future generation. The consequences of turning a blind eye to that which allows 1.2 million to maintain their autonomy, immune competence, and cognition has led to the reactivation of tuberculosis, an AIDS-defining illness and the #1 cause of death in the HIV-positive population in HIV-negative members of the current and future generation. If we are going to avert the crisis unfolding before our eyes, we must immediately roll out a massive drug repurposing campaign as China did. Failure to do so ignores the fact that distributed throughout the very organs required to excrete and metabolize every single drug class is the very receptor upon which this virus relies, ACE2. In closing, the 16th President of the United States, Abraham Lincoln, immortalized in marble and sitting behind me once said, "At what point then is the approach of danger to be expected?" I answer, if it ever reaches us, it must spring up amongst us. It cannot come from abroad. If destruction be our lot, we must ourselves be its author and finisher. Clearly, we chose to be its author. Will we be the finisher? Thank you.